Okay, if you'd like to say your name and student number then.
Joe Smith, and my student number is 312713. My first health condition is obesity. This is because obesity is one of the worst growing health issues worldwide due to the increase of portion sizes and the rise of fast food restaurants. This epidemic has got so bad that 67% of men and 57% of women in the UK are either overweight or obese. Module projections suggest that indirect costs could be as much as 27 billion by 2015, and the cost estimated at 1.4 trillion worldwide. The first definition of obesity is a term used to describe somebody who is very overweight with a lot of body fat, and that's by NHS Choices. Another definition is obesity is an abnormal accumulation of body fat, usually 20% or more over an individual's ideal body weight, and that's by Frolics. I prefer the NHS Choices definition of obesity as they don't include statistics. This is because obesity can be different for each individual person, and you can't rely on figures to tell you how overweight someone really is. The factors that contribute to obesity are genetics, age, certain medications, family lifestyle, inactivity, poor dietary choices, lack of sleep, social and economic issues, and other illnesses and conditions such as type 2 diabetes. The reasons that age affect obesity is that older people might not be able to exercise due to injuries or fatigue, which will make it easier for them to put on weight. As older people find it harder to lose weight if they are obese, which has bigger risk of getting other health complications such as diabetes and arthritis due to the excess weight and strain on the joints. The reason social and economic issues can affect obesity is that families with less money will actually choose the cheapest options, which is usually the unhealthiest. This will contribute to an unhealthy lifestyle including processed and fatty foods. The main symptoms of obesity are being short of breath, feeling tired, varicose veins, sore joints or muscles, skin problems, and irregular periods. These symptoms are quite easy to detect as they are all linked to a high BMI and general health problems, including being short of breath as the heart has to work harder to pump oxygenated blood around the body. General health is dramatically affected by obesity as it can be the gateway to other health conditions such as coronary heart disease, stroke, type 2 diabetes, high blood pressure and abnormal blood fats. As well as regular exercise, a balanced diet is the best way to treat obesity. The diet required will remove all saturated fats and other unhealthy high-calorie foods. To overcome this, there have been stricter rules on food labelling and also various schemes such as School Fruit and School Milk schemes and free food for Europe's poor. There has been various government schemes to help treat and prevent obesity, such as the Change for Life scheme, which combats family with lazy lifestyles by introducing a nutritional program and free exercise programs for the whole family. Asthma. In the UK, over 1,140 people die from asthma each year. This could be down to the fact that more than half people with asthma don't think that they are at risk, that's 52%. Asthma is not on the list of conditions exempt from prescription charges. This means that every item prescribed for asthma by a doctor will cost a standard prescription charge. The cost of an item on prescription is £7.20. This is from NHS England. A definition of asthma is a common lung disorder in which inflammation causes the bronchi to swell and narrow the airways, creating breathing difficulties that may range from mild to life-threatening. That's from MedicineNet. Another definition is proximal of allergic disorder and respiration characterized by bronchospasm, wheezing and difficulty in expiration, often accompanied by coughing and feeling of constriction in the chest. That's by dictionary.com. The MedicineNet definition is the best in my opinion as it states it can be mild or quite serious, whereas the other definition just describes what it does. It doesn't really describe that. It could just be like mild or very serious. The factors that contribute to asthma are age, gender, smoking, fitness, pollution and pets. Asthma also links in with obesity, as asthma can be more severe if you are obese due to short of breath and more strain on lungs and heart. There are common allergies with the sufferers of asthma. 30% of people with asthma are allergic to pets. Dogs cause the most common reactions due to the proteins in the pet's skin flakes, urine, saliva and hair. Although removing a pet from the house will be most people's go-to response, there are in fact no clinical benefits for removing the animal. The main symptoms for asthma are coughing, wheezing, loss of breath, panic attacks and mucus production. In my opinion, panic attacks are the worst symptoms, as it can be triggered by stress and nervousness. Due to this, the loss of breath and panic attacks could be triggered anyway, meaning the sufferer might not have their inhaler on them, which could cause fatalities. Your health can be tested with asthma, as it is very common to be accompanied by hay fever and eczema. The condition is generally down to genetics, and most sufferers will outgrow it, but some could get more severe and will have to make sure they have their inhaler with them always. Asthma can be more dangerous if you're overweight, so you should stay away from high saturated fat meals and other foods that you're allergic to, such as nuts or seafood. Another dietary problem is that the excessive amounts of alcohol could cause you to forget you actually have an inhaler, or just you could lose the ability to use it. The British Occupational Health Research Foundation are trying to reduce asthma accidents at work by providing evidence-based recommendations on which future practice can be based. They found 22 recommendations in 223 studies. The results show that the test was not so successful, although a minority of the tested think the recommendations were useful, so that could mean that the test could need improvements to make it even more successful. Diabetes. Diabetes is quickly becoming even more of a worry since obesity is a controlling factor. And Diabetes UK state that the number of people diagnosed with diabetes in the UK has increased to more than 3.2 million. A new report published by the journal Diabetic Medicine has projected that the NHS annual spending on diabetes in the UK will increase 9.8 billion to 16.9 billion over the next 25 years. The definition of type 1 diabetes is type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin. That's from Mayo Clinic. Another definition of type 2 diabetes this time is a common form of diabetes mellitus that develops especially in adults and most often in obese individuals, and that is characterized by hyperglycemia resulting from impaired insulin utilization coupled with the body's inability to compensate with increased insulin production, and that's from Merriam-Webster. The difference between both diabetes is that type 1 diabetes doesn't produce enough insulin. Type 2 diabetes produces the insulin, but the cells that need it will not accept it. Factors that contribute to type 1 diabetes are genetics, viral or bacterial infection, chemical toxins within food, and unidentified components causing autoimmune reaction. In type 2, it's obesity, bad diet, living a sedentary life, and increasing age. Type 2 diabetes is also linked to obesity, as the excess weight can cause even more problems, such as amputation due to the body using its own cells for dietary nutrients. The reason that increasing age affects diabetes is that you could put on weight due to the lack of exercise, and they might not be able to afford a healthy food and a healthy lifestyle if they're relying on their pension. The main symptoms of diabetes are increased weight, increased urine production, increased thirst and extreme tiredness, also unexpected weight loss and blurred vision. The worst symptom in my opinion is weight loss / weight gain, as both of these could be fatal. This is because the increased weight will make it harder to exercise to control the diabetes, and it can lead to other serious health conditions such as CHD or strokes. The reason that the weight loss could be fatal is that your weight could drop below an unhealthy below your BMI, which could cause malnutrition and dehydration. Anyone with diabetes is more likely to damage their eyes, kidneys and blood vessels than the general public. Also, weight can rapidly decrease due to the illness consuming fat that is necessary in the body. Although all these effects can be delayed or completely avoided through careful blood sugar control. Diabetic food contains more fat and energy than regular food, but Diabetes UK are campaigning to have special labelled diabetic foods removed from the shelf, as just having a balanced diet and keeping to the daily guidelines is enough to stay healthy. Also, eating magnesium-rich foods, such as some diabetic foods, can help promote healthy insulin production, which could lower the risk of type 2 diabetes. The government have backed the hybrid labelling scheme, which they implement the traffic light colours into food labelling to show how harmful certain foods could be. This will decrease the amount of people getting diabetes, as they will be more aware of what they're eating, and they could think twice about eating some fatty foods. Depression. About a quarter of the population will experience some kind of mental health problem in the course of a year, with mixed anxiety and depression, the most common mental disorder in Britain. That's from Mental Health Foundation. Depression affecting hundreds of thousands of people across Britain is costing the nation's ailing economy $8.6 billion a year and $3.3 billion more than a decade ago. The definition of depression is depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. That's from Mayo Clinic. Another definition is depression is a common mental disorder characterised by sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, and feelings of tiredness or poor concentration. That's from WHO. I prefer the definition from WHO over Mayo Clinic, as the Mayo Clinic definition only says the basics and doesn't fully explain the moods and feelings associated with depression. It's not known exactly what causes depression, but the factors that contribute to are biological differences, brain chemistry, hormones, inherited traits, life events, loss of a loved one, and excessive amounts of stress. In my opinion, brain chemistry is the most important factor that can contribute to depression, as it applies in all of the other factors. It is the one that reacts to the loss of a loved one and life events. Also, loss of a loved one is a factor that can contribute to depression the most, as everyone will react differently. This is why it's so hard to find what exactly causes depression, because everyone will act differently and you can't pin the same condition on different feelings. There are a few symptoms to depression, such as feelings of helplessness and hopelessness, loss of interest of daily activities, appetite or weight changes, sleep changes, anger or irritability, self-loathing, reckless behaviour and self-harm. Self-harm and feelings of helplessness are the most obvious symptoms, in my opinion, as they both show physical evidence and forms of depression and cause the sufferers to act out. Another serious, other than serious self-harm, I would say appetite and weight changes are the most troubling, as they could cause different dietary problems, as well as other eating disorders such as anorexia and bulimia. Obesity also links in with depression, as depression sufferers could eat more than usual to comfort them, and also people with obesity can become depressed because of their weight. Depression can also link within a lot of illnesses or diseases, as they can give you feelings of helplessness and hopelessness. There are some health implications associated with depression, such as 2 out of 3 people experience aches and pains and experience of chronic fatigue, plus loss of weight due to the decrease of appetite. Diet can be quite effective cure, as protein can make you feel more alert and less fatigued. Also, smart carbs create a calming effect that makes sure there isn't an unexpected loss of weight. You could also use a Mediterranean diet with a lot of vitamin D. The most important thing is to stay at a healthy weight and eat a balanced diet. The government scheme to increase the awareness of depression and to aid those with any mental health condition is Mind UK. They influence the government for support, and they can also aid people with counselling and psychotherapy. Are there any questions?